Hello, everyone, and welcome to our first Kids Come First webinar on PPE coaching. Today's webinar should last approximately 30 to 45 minutes. So just giving you all some guidelines here around our Zoom. We are currently recording this webinar to share with all of our partners and stakeholders who couldn't come to our webinar that we have placed on Tuesday, May 5th. And what we're doing right now is that we do not have anyone live on this webinar, so there's no Q&A portion in this recording, but if you do attend our May 5th webinar, you will have the option to take part of our questions. And whichever questions that do come forth within our May 5th webinar, we will be creating a frequently asked question document that we will share as well as this recording, so you will feel like you were part of that May 5th webinar. So our agenda for today is the following. We have a part 1 and a part 2 process. So part 1 really is about the precautions of PPE and talking about PPE. So essentially a PPE 101 overview. And we will be showing you all a demonstration of donning and doffing. Then the second portion of this webinar will talk about the implementation process around PPE, helping non-medical staff learn PPE and other fun tools that one agency can use if and when they do want to start and create their own process around PPE in their organization. So a little quick introduction. The two individuals that are here today that will be doing the PPE coaching are myself and Monica. So I am one of the community program leaders within the community-based operations and partnership in response to helping our Kids Come First around any COVID-19 related efforts. So for example, this webinar and other webinars that we've offered. And then I will leave Monica to introduce herself.
Hi everyone, thanks for joining us today. My name is Monica Brannon and I'm one of the nurse educators at CHEO. Throughout this whole COVID-19 journey over the past couple of months, I've become somewhat of a PPE coach. And so I'm really happy to share that knowledge with you guys today, along with Mary.
Perfect, thank you. So without further ado, let's get right into our webinar. But before we do so, there are just a couple of disclaimers that we do want to share with you all. So we want to note that these slides are to help organizations better understand when it is appropriate to use PPE, how to use PPE, and finally implementing PPE in one's agency and or organization. And we are asking that everyone do follow their public health guidelines and their ministry and funding guidelines for any instructions on how to work within your clientele during a COVID-19 world. So our webinar here really is to just coach and help and show you all what we've done at CHEO around helping non-medical staff learn the ropes around PPE and how we've implemented PPE within our process outside of our traditionally medical clinics and units. So we'll get right started with our part 1, and I will then give the floor over to Monica.
Great, thank you, Mary. So today's webinar, as Mary mentioned, is exclusively on PPE coaching, and we'll head to the next slide. So before we talk about PPE, I want to talk a little bit about ensuring routine practices. Today we're going to highlight a point of care risk assessment, and I'm going to talk to you a little bit about that later. We're going to talk about hand hygiene, cleaning and disinfecting environment and your equipment, proper use of personal protective equipment, so PPE, proper handling of waste and linen, education of clients and families, restriction of visitors, which I'm sure you've already started implementing. And as always, consult your PHAC, so your public health agency, for details on your point of care risk assessment, your hand hygiene, and different cleaning solutions. So we'll head to the next slide. Now I'm going to start with part 1. We're going to overview your PPE. We'll go to the next slide. So PPE stands for personal protective equipment. Now, this could be one of or a combination of gloves, gowns, masks, eye and face protection. We'll go to the next slide. Before we talk about the actual PPE, I just want to talk to you a little bit about the mode of transmission. So there's 3 different modes that I'm going to explain to you today. I'm going to start with explaining contact. So So we'll head to the next slide. So contact mode of transmission, and I'm going to read through this for you. Transmission through contact means coming into physical contact with someone who has an infection or something that is contaminated with virus or bacteria. So this contact can be direct, but it can also be indirect. So let me explain the difference between the two. So for direct contact, if you touch someone with a respiratory infection, for example, and then you touch your eyes, mouth, or nose, you might then have exposed yourself and could become ill. So for example, when someone coughs into their hand and shakes your hand, the infection can be transmitted. That's direct contact. Now let me talk to you about indirect contact. If you touch an object that has been contaminated by someone with an infection and then touch your eyes or mouth or nose, that infection can be transmitted. So if someone coughed into their hand, touched the doorknob, left the room, you walk into the room, the person's not in sight, but you go to touch the doorknob, you've then had that indirect contact. So head to the next slide. There's two other modes of transmission. The next one is droplet. So the droplet is large particle respiratory droplets. They generally only travel a short distance. So that's that less than 2 meters through the air. And then they settle out of the air quickly. Now for airborne, these are smaller particles. These are droplets, they evaporate, they're extremely light, so they can remain suspended in the air for a longer period of times. They can also travel much further than that 2 meters. So the difference between these two is important to note for our COVID infections that we're dealing with in today's day. If we head to the next slide, I'm going to talk to you a little bit about how we protect ourselves from COVID. So in COVID infections, they are transmitted through contaminated surfaces or droplets. So we would use droplet-contact precautions. So certain infections can be effectively transmitted by large particle respiratory droplets and or by contact with the person or their surroundings. So that's that direct and indirect. Large particles, respiratory droplets are released by talking, crying, coughing, and sneezing and can travel up to 2 meters in the air. Droplets are also released during high-risk aerosol-generating respiratory procedures. So this is when that becomes airborne, when COVID infection would become airborne. We're fairly certain that in your agencies, you are not performing these aerosol-generating procedures. We did put this inclusive list here for you to verify, to be confident in the decision that you're making. So for COVID-19 infections, droplet contact precautions are what we would be using. So let's head to the next slide and I'll talk to you more about that. Before we are actually going to decide to don, which is just a fancy word for put on your PPE, we need to be sure to do a point of care risk assessment. Unfortunately, we know that we do not have an abundance of PPE and we need to make those decisions responsibly if it is time and if it is necessary to don or put on that personal protective equipment. So before you're going to actually interact with the client, it's important to ask yourself some questions. The questions are, will I be exposing myself to a splash or a spray? Will I have a contact with the patient environment or your client's environment? Will my hands be exposed to blood, excretions, secretions, or contaminated items? Will my face be exposed to splash, spray, coughs, or sneezes? Will my clothing or skin be exposed to splash, sprays, or items contaminated with blood, excretions, or secretions? Another question, does the patient have a known infection or symptoms of an infection? So in order to make this decision, what is a nice tool that we have is a decision tree. So if we head to the next slide, I'll show you what that decision tree looks like. Now here it is. Don't be overwhelmed thinking that this looks really big. I could never possibly get through asking all these questions before interacting with a client. The questions I just talked about are embedded within these green diamonds. On the left, you'll see the purple rectangles, which provide you with the answer, do I wear gloves? Yes, in this situation, you would wear gloves and perform hand hygiene. Yes, you would wear a face protection. So it guides you through and it lets you know in what situations you should be donning PPE. So we'll go to the next slide. So for droplet-contact precautions, the PPE that you would be wearing are gloves, gown, mask, and eye protection. But don't forget that you do need that hand sanitizer to don and doff. So we'll head to the next slide. So you've gone through your decision tree, you've asked yourself all the important questions, and now you know you do need to be donning PPE to have this interaction with your patient or your client. So what's next? It's important to know how to properly don, which again, fancy word for putting on, and doff, taking off your PPE properly. This is in order to prevent yourself from contaminating yourself, your environment, your colleagues, other clients. So that's what I'm going to show you how to do today. I'm going to show you the steps and the techniques to use in order to keep yourself safe. So head to the next slide. We're providing you with some resources that you can refer to later. So don't think you need to be jotting down notes as you're watching me don and doff, because we do have these for you to reference afterwards. So this is a poster of putting on or donning, and then also taking off or doffing your personal protective equipment. And we'll head to the next slide. I'll just make sure I'm on track. We do have a video that we're going to be sending you along as well. Again, it's a handy way of just knowing the steps and the techniques to use. A little disclaimer, we have recorded this at CHEO. There is medical equipment in the background. We have big doors that we use when our patients are isolated, but don't let that distract you from the actual concepts, and the techniques still remain the same. So don't get overwhelmed by that, but you'll have that as a reference tool as well. So head to the next slide. This is also another video that we're giving you on mask donning. And the next slide, and I think it's my turn to actually demonstrate for you. So I am going to start the demonstration by putting my, you can see it, my hand sanitizer front and center, because we know that's a really important step when you're donning and doffing in order to keep yourself safe, knowing that you're not going to contaminate yourself or your environment along the way. So the first thing we're going to do is sanitize our hands with hand sanitizer. You want to make sure that you are sanitizing your hands for a good 15 seconds. And when you do that, and I'm going to demonstrate for you again, when you do that, you're going to get your thumbs, you're going to get between your fingers, and you're going to sanitize for 15 seconds, which might feel like a lifetime. We do recommend no jewelry from the wrist down, so no watches, no rings, because it does decrease the risk of contaminating yourself. So I've sanitized my hands. The first thing I'm going to do is take my gown, which I have behind me here. When you select your gown, you want to take a look at it. You want to hold it up. You want to make sure there's no tears in the front. It looks like it's going to fit and go around me. You want to make sure the wrists are long enough. So I'm going to put on my gown, or don my gown. There are two ties. The one tie will go behind your neck, and you want to always make sure to tie both ties. I'm going to show you here what happens if I don't tie both ties. So right now I've just tied behind the neck, and if I don't tie back there and I go in, my entire back could be exposed to the patient or the environment. So I want to make sure to tie that waist tie as well. So I'm tying that waist tie, and then I've got my gown on ready to go. My next step is a mask. So for this demonstration today, I'm going to be using a surgical mask. My mask actually has a shield on it for eye protection. Take note that there are many, many different masks and face protection out there right now. I'm showing you a mask with ear loops, which is very common for a surgical mask or a medical procedure mask. And I'm going to loop it around my ears. But you might have a mask with a tie. You might also have goggles for eye protection. Just remember the concept's the same. So when I'm putting on my mask, I want to make sure that this softer part is on the inside. I'm going to loop the ears loops around my ears. And I want to make sure that my nose, my eyes, and my mouth are all covered nicely. It's really important to take your time when you're actually putting your mask on. You want to mold it around your face a bit, pull it down here under your chin. If you do not, it tends to do this when you go inside the room. And then the first thing you want to do is touch your mask, which is an absolute no-no. You never want to touch your mask because that's when you contaminate yourself. Never, never touch your mask. So you fit it properly and take your time before you go into the room. Your next step is your gloves. So you're going to take your pair of gloves and you want to put the gloves on and you want to put them on top of your sleeve. You don't want to have a space like this when you go into the room because that's when you can contaminate yourself. So put your gloves on top of your cuff of your sleeve. And remember, I'm still outside the client environment. And now I'm ready to go inside. Okay, so we've gone inside and we've seen our client, we've had that interaction, maybe some direct, indirect contact, and now it's time to leave the room. So one of the riskiest parts is actually doffing the PPE. So you want to make sure that you do it in the steps and the technique that I'm showing you here today. So you're still within the client space, but you want to make sure you're at least 2 meters away from your client. The first thing you're going to actually doff or take off is your gloves, the dirtiest part of you. So when I was in that environment, I could have been touching maybe the chair, maybe I interacted with the client. So my hands are the dirtiest part of me. So I want to remove my gloves first. When I do that, I want to use a glove to glove, skin to skin technique. And then I take it off and it's in a little bit of a pouch and I put it in the garbage right away. The first thing I do is I'm going to hand sanitize for 15 seconds. And I want to make sure that my hands are clean before I start to touch my gown. So then I'm going to untie my gown. I've got two ties to untie the neck and also the waist. When I'm taking my gown off, I want to be very careful that I'm not going to contaminate my clothing underneath my gown. So I like to pull my gown down a bit. I like to lean over. So that the gown does not touch me when I take it off. And into the linen or the disposing it goes. I'm then going to sanitize my hands again. After every item is removed, while you're doffing, you are then sanitizing your hands. So I'm still inside the client space at this time, 2 meters apart, but I can now take my mask off. I'm going to lean over the garbage. I'm going to take my ear loops off. I'm going to drop it into the garbage. I'm going to then sanitize my hands again. At this point, 15 seconds of sanitizing. At this point, I'm then going to open the door to go out of the patient room or the client's room. Open my door, shut it, and then I sanitize again. So that is donning your PPE and doffing your PPE, following those steps. So go back to the slideshow and I'll just make sure that we're on track. Perfect. And I'll let Mary take over for part 2.
Perfect. Thank you so much. All right. So now that we've gone through part 1 and we have a better understanding of why we PPE, when we PPE, and how we PPE, the second part of this webinar will be discussing implementing your own PPE practice within your own organization during COVID-19. So we've created a 10-step process around the idea of implementing from part 1 around that PPE understanding and knowing when and how, right to the end of receiving feedback, discussing with your employees, discussing with your colleagues and your clients around the processes that you've put in place. So step 1 is really just setting some ground rules around your organizational needs and how you've adapted in a COVID-19 world with your clients in your space. So this will help you understand when and how you need to PPE and at what limitation. So the key point here is really emphasizing who should be on site. What are the ground rules that you're setting organizationally? Are you really moving towards all virtual care? For those that can do virtual care, how will you then emphasize that with your staff who are then deemed not essential to be on site? And then asking yourself, for those who need to be on site, how do you then put through a screening process upon entering the building? Are you creating and factoring extra time for each client? Are you ensuring that there is that 2-meter distancing for those who are not flagging or screaming yes to any of your questions? And how can your space be in the sense that how can you appropriately space your appointments around and about to factor in that extra time required to effectively greet each person at your entrance? So again, you're really emphasizing that ground rules, that organizational rules. Your second step is proactively limiting people in your building. So again, it ties in with your first step. So here we're asking, can your organization limit how many people, so staff, clients, etc., can be in the building at any given time? So if possible, one can do the following to reduce people in the building. Can you call your clients to ask if virtual care is a possibility for them? In a given day, can you move essential appointments around with clients to be able to space apart the appointment and to utilize your largest room to ensure and maintain physical distancing? And if it's unpredictable and the client flow is a little more sparse or sporadic due to your organizational needs, then it really does reinforce the importance of understanding the need of PPE and understanding who needs to then be in PPE when interacting with certain clients. Your third step is setting up that physical distancing to prevent the need of PPE for non-symptomatic client interaction. So as Monica mentioned earlier in part 1, there is a bit of a decision tree that one may go through to really understand, if I am meeting with a client right now and the client is non-symptomatic, do I really need to be in PPE if I've set up steps 1 and 2 accordingly, where I do not and will not be in close proximity or less than 2 meters with a client who is asymptomatic? So these are just things that one can do to ensure the practice of physical distancing in one's space and within client interaction. So clearing out your physical space as much as possible and move all non-essential items out of your office and main foyers. Place tape down to create bubbles or spots for your clients, your staff to stand and or sit. Creating signs that tell people how you expect them to behave when in your space. So again, you're setting those boundaries which you've established organizationally in step 1. And can you find a room that is large enough to alleviate the need for PPE with clients who have no symptoms and who have passed your screening to enter the building when interacting with them? Your fourth step is to do an inventory of supplies that you have and do not have. So the goal of this step is really to see organizationally what supplies you have in respects to PPE and what supplies you have to implement your own PPE practice within your organization. So you're checking for the following supplies, as Monica mentioned in part 1. You're looking for your procedure masks, your gloves, gowns, visors, face shields, or any goggles. So this step is important to work with your senior leadership on this, to either create an Excel sheet or to implement an Excel sheet, do some tracking around inventory checks. And we're also going to be sending a survey post-webinar to fill out to see what PPE one organization may require if they've done their inventory and see that there are certain gaps after they've assessed when and how and at what level of PPE one is required if a staff and or a client is essential to be on site and they require to be in some form of PPE. Your fifth step is deciding when and what type of PPE is necessary for your organization. So I won't get into this one in detail because Monica already spoke of this And we also shared our decision tree around helping organizations better assess what type of PPE is appropriate and when PPE is deemed necessary to wear when you are interacting with a client. Your fifth step, again, is just more additional tools and more visual aids to share with you all around the need and the emphasis of making sure that you have as much visualization and visual aids as possible in your organization to help both yourself, your clients, your staff better understand why you've put these processes in place, given the new way of working with one's client or one's organization in a COVID-19 world. Your sixth step is to do a bit of a benchmarking exercise. So we're suggesting that other organizations like yourselves who work within similar clientele or have very similar missions, what they are doing in response to COVID-19. So again, we're asking and saying, hey, a benchmarking exercise with your external partners who work in similar environments may be nice, just to see if you're on the same page, just to see if there's anything that you may have thought of that you can share with your colleagues and your external colleagues, or if there's something that one of your partners is doing that you feel that you could then implement because you work within that same clientele nature. Ask how many clients they're allowing in their space, for example, in a given day, if that's a controllable variable for your organizational needs. Ask what inventory they have in regards to PPE and what supplies they've decided to use and why. And lastly, once again, is connecting with your public health to get updates for additional guidance on when to update your staff on COVID-19 related news. And if there's anything you need to know organizationally to adapt or change or modify in respect to what your public health updates are telling you and giving you. The seventh step here is printing visual aids. So I did mention this a little bit earlier on around the need and the usefulness and the added benefit of having visual aids in your work environment to support your staff and your clients in helping them practice either proper hand hygiene or giving them some better insight as to why sometimes one of your staff members may be in some form of PPE. So you have those visual aids explaining why this is important to practice. So for the hand hygiene, for example, it prevents the spread of infection. And if you have the visual aids around and Ottawa Public Health and your public health agencies have great resources on this, it'll really emphasize and kind of create that cohesion around the need and the importance of working as one team and working as a collective to further spread the infection, or to really just emphasize the importance of, hey, we're all in this together and we're learning together, and let's put those visual aids in place so we can support one another. And then you're asking your staff and clients to then, for example, remove gloves upon entering, right? So you're kind of setting in processes, but if you explain why and you visually explain why, it'll really help alleviate any added stressors from your staff and your clients who then may feel the need to ask all the whys. If you have them on the wall, it may alleviate those whys and may give people a better idea of how and when, and then the whys will no longer be a factor in decision making. Your eighth step is practicing donning and doffing. So as you saw Monica demonstrate a visual aid around donning and doffing, it's really quite important to try it for yourself, because as Monica mentioned, it's really the steps and the techniques to proper donning and doffing that are important. So you don't need to have actual PPE to do this, because we are mindful of not wanting to waste any PPE. So you could essentially practice with a glove, mittens. You could practice with a jacket, non-medical mask. And again, it's really emphasizing the steps and techniques to proper donning and doffing. And then you can ask us afterwards if you need to have another 15-minute additional check-in to see whether or not you are donning and doffing correctly. We do have all the visual posters that we will share your way. We will be sending this webinar, and we do have the video on YouTube showing and emphasizing donning and doffing with French closed caption subtitled at the bottom as well. Step 9 is attempt and change. So we're asking agencies to have the, well, we're not asking, really, we're just saying that at this point in the game, all agencies should have the following processes in place. There should be physical distancing processes. There should be some proper hand hygiene process, and we should at this point know when to wear PPE and how. So again, no matter what that first draft looks like on your end and what those processes look like, it really is better than any draft you had yesterday. So our suggestion would be around just trying it, collecting feedback from your clients, your staff, your senior leaders, yourself, iterate, modify, and then check in with your public health if you have any further questions around whether or not you feel that you are donning, doffing, and following the PPE process accordingly and with reason. And finally, step 10 is understanding and implementing a proper disposing structure for PPE. So as you heard Monica in the donning and doffing demonstration, making sure that you are appropriately leveraging over a garbage can to throw whatever disposable PPE is required and then rolling any reusable gowns in place, you're allowing your organization to have a proper structure in place. So proper disposal of PPE immediately after doffing and before leaving the client's environment is key in reducing risk of contaminating yourself, your colleagues, your clients, and your environment. And then we're going to talk a little bit about supporting non-medical staff to learn and understand PPE. So this is a big one for all of us. This is a big one for myself. I typically work in a mental health environment where donning and doffing are all terms and words that I just learned about maybe 6-7 weeks ago. And I didn't necessarily know and understood what PPE even stood for. But at this point in the game, we're all finding our ways adapting to COVID-19, and we're all finding ourselves learning new terms and new ideas and new tricks to help support ourselves in this transition of COVID and making it so all of our clients, our staff, and ourselves are feeling safe during this process. So essentially what we've put together here is when you're supporting non-medical staff to don and doff, it is important to spend the time before staff don for that first time to explain what is PPE, what it stands for, and why it is being used during COVID-19. So using this webinar recording for an example, or watching any YouTube video that you find that has been deemed appropriate by public health to really explore the reasons why we're doing this. You're giving staff an opportunity to rewatch the videos of donning and doffing and to give them the space to fully grasp the concept. Staying with them as they don for the first time and being with them when they require to doff. And at this point, when we say staying with them, that can also be virtual too. Putting visual aids around, as we talked about before, giving kudos to your staff for stepping out of their comfort zones, asking for feedback from their experience, and offer an optional post check-in with staff who have donned or doffed for the first time to make them feel truly supported during this experience, and helping them really emphasize and helping them as they shift through that change in their own service delivery. So additional information we have here is early feedback from staff is critical. Feedback from your client population is equally important as well. We want our staff to feel safe, but we also want our clients to feel safe during this process change as well. Universal understanding and agreement from your organization when it is needed to don and doff. The less is more model. So the process should be simplified to minimize the chance of errors from a non-medical staff's perspective, who now need to understand and now wear PPE and learn and know what PPE is. PPE, again, should follow public health guidelines. You should have visual aids to help with wearing PPE. And then putting your policy and process of PPE in writing. So creating a document, an internal document for your staff, so they have at their disposal so they can review when needed. And for specific questions regarding your organization's unique nonprofit needs, you can connect with us as well. So we are also a service, and we are also an opportunity to ask any questions you may have our way. We may redirect you back to public health guideline websites, but there are certain things that we do have in place here that we can share and also further explain if and when these questions arise. And here we just have an example, for example, just a little SWOT analysis really around implementing PPE in an organization for the first time. So tapping in and utilizing on your organization's strengths, tapping in and understanding what those weaknesses may be from an internal perspective, all the opportunities that you may have from an external point of view. So hopefully this webinar has served as an opportunity. And then having a bit of that open understanding of that threat around what are those uncertain pieces of COVID that we cannot control, unfortunately, but if we put in our other steps in place, we can hopefully alleviate some of those threats. And then finally, from Monica and I, it's okay to feel uncomfortable or uncertain about this process. It's normal to feel uncertain about PPE. It is still new for many of us, new for me personally. However, PPE coaching has helped decrease a lot of anxiety to all of our non-medical staff, further understand and know why they're now wearing PPE and the importance of it. So the more you know, the more you understand. And really, right now, PPE is not meant to scare people. It's really just emphasizing that it's a new way of the world during this COVID-19 journey when we are interacting with our clients that we care so deeply for. So that's part 2, and that concludes part 2. As we mentioned earlier today in the recording, we do not have any live audience with Monica and I right now, so there is no Q&A for this portion. But on behalf of Monica and I, we would very much like to thank you all for listening to our webinar. And if you have any questions at all, please do not hesitate to reach out to us. I don't know if you have any final remarks to say, Monica, before we stop.
I just wanted to say thank you so much. And I echo what you would say, that even as a healthcare provider, as a nurse, we always need reminders and reviewing, and PPE is not something that we're all experts with. So don't be intimidated by it, but just use the techniques and what we've shown you here today.
Thank you, everybody. Have a good day.